Hello, everyone, and welcome back to the Hobo Thinga podcast. My name is Crystal Cedino, and I'm the Training and Development Manager for the Native Learning Center, and I'm really thrilled that all of you are tuning in for another episode. So thank you, thank you, thank you. Today on the show, we're excited to be speaking with Bart Garber, Director of Business and Planning, and who is also a Board of Director. Go ahead and say hi, Bart, and wave to the camera.
Hello.
There we go. And we also have John Coley, who's VP Healthcare Development and Tribal Relations. Go ahead and wave and say hi, John.
Hello.
Thank you. And then we've got Amy Brankus, who's the Chair and Owner. Go ahead and wave and say hello, Amy.
Coley.
Thank you so much. And then we also have Darla Dick, who's the HR Administrator. Go ahead, wave and say hi, Darla.
So everyone.
Awesome. Ashley Hesse as well, who is the VP of Policy.
Yep, howdy.
Thank you. And we have Rose Bear Don't Walk, who's consultant.
Kasquext.
Awesome. And last but not least, we have Nicole Fields, who's the Business Development Associate. Go ahead and wave and say hello, Nicole.
Quay, hello.
Awesome. I am so happy and glad that all of you made the time to be here today. So thank you. Thank you. I actually don't think we've ever had this many people on one podcast episode. So I think this is really, really cool. So again, thank you. All right. So today we're actually going to be talking about who is Indigenous Pact, what is the work that Indigenous Pact does, and all of the wonderful things involved. So let's go ahead and jump in, and I'm going to start off with the first question for our listeners. Why was Indigenous Pact founded, and what need do you see in Indian country?
Well, I can answer that. Indigenous Pact was founded with my husband and I. My husband worked in healthcare for his entire career at a corporate level, and we were in Ohio where there's no federally recognized tribes. And when we adopted my nephews during a tragic circumstance, we needed to get them care. They came off the reservation to come stay with us. And if we wanted to get them care, we'd have to drive to New York to the closest IHS facility while we were waiting to figure out their, healthcare benefits transferring over. And Kurt and I were just like, this is crazy, that was the catalyst. But the thing that our hearts connected to were when we lived in Oneida. Kurt and I had both of our children through IHS, and we would get the vouchers for a delivery, and our first baby was healthy and happy, and we'd go to the health center and you just get a checkup. We never needed care that was life-saving. And then with our baby, when he was born at an IHS hospital, our baby Kai, he was wheezing when he was born. And I remember the nurses looking at each other and, kind of whispering, and they're like, no, it's fine, it's fine, it's fine. And they called in all these other nurses, but they didn't call in a specialist because in the eyes of the hospital, it's uninsured if you have this IHS voucher, preferred care. And at the time it's called contract health. And, then Kai and I went to the health center at 4 days old, and I was like, I think he's allergic to something, or he's having trouble breathing. And the doctor there actually just gave me an inhaler and was like, bring him to the emergency room if he has trouble breathing. Fast forward to 8 months old, he had this lung disease for 8 months. And then when we moved to Ohio, he was on life support, because he had not received the specialist referral or, the intervention he needed upon birth. And, he almost died. And my mom had told me, she flew down while he was in the intensive care unit, and she said, that same hospital is where your grandmother had brought a baby, my Uncle Danny, and he was a baby. He was a couple months old, and she was begging them to help her, and they didn't help her, and her baby died in her arms in that same hospital in the waiting room. And so Kurt, having spent his career as an executive, said, this is crazy, like the catalyst with Jax and Jonas and realizing they couldn't get the care they need, almost losing our own child. Looking at the statistics, they're outrageous and staggering, and of health disparities, and there's no markers for quality of care, and realizing that so many people have these stories, and so that's the beginning of IP. It's very intimate and it's very painful for me to even talk about, but I am just so grateful that we have the team we have. And traditionally, I wouldn't speak first. I would pass it on to the others. But I just wanted to answer that and start with that. And I'm so excited to hear from everyone else. And thank you, everybody, for coming today.
Absolutely. Thank you for that. Definitely, I can see that it's definitely a personal story and something that is a huge catalyst for why IP, would start. It's definitely a need within the community. All right. Well, as far as, needs in Indian country, did anyone have anything else that they wanted to add to, that part of the question? To open it up. That one. 7 of you. All right. No?
Well, no, I would just add that, I had the great pleasure and wonderful opportunity to meet Kurt and get to know Amy and the family. It truly is. It's a heart-driven mission, and in a lot of ways, the need is it's beyond words, and it's beyond most people's comprehension, because it's just like you can't believe this is happening in our own country, in our own backyards, to our First Nations, to our First People, and there's just so many things about it that when I heard Kurt talking, I got to understand his intent and the mission. Immediately I'm like, sign me up. I don't know what I can do, but sign me up. So that's all I'll add to that. It's definitely a powerful story, but we're on a very important mission, I would say. So.
Definitely. Absolutely. Great. Well, let's go ahead and jump into what makes access to health care within Indian country difficult to provide to tribal members.
Go ahead.
Go ahead,
Please,
Ashley.
no, go ahead, Darla.
I want to say, just in general, the amount of red tape and the amount of steps during an approval process. Sorry, the wind blew my door open and my dog's in here. Sorry, so sorry. But I think the access to the proper steps that you need to take, there's almost this illusion that's around healthcare in Indian country that no one really knows all of the steps to take, or the steps change due to, grant funding. And I think, that's probably the most frustrating part for folks who don't work even within the tribal community, and I'll give personal examples of that, working within it. I knew things because I worked within the tribe. My parents who weren't connected as I was, didn't know of a way to find information on how to access certain programs and how to access. So there's a communication barrier that I think is there based off of, again, contracts and changing programs based off of funding that a lot of our healthcare systems have to run off of. So I that would be the biggest item that I would point out, is a lot of the access in general, direct access. And I know the team will probably share much more, but that stands out to me both on a professional and a personal level.
And
Definitely.
I'd like to, I can add on to that as well.
Yeah.
I think the biggest thing is that I don't think people realize how underfunded these tribal clinics are. If you really look at the statistics, the people that are in prisons or state jails actually have better access to healthcare and provided that funding of access in healthcare. So I sort of have a personal story as Amy too, why it's we here at our tribe have like a priority system because we're so underfunded for our healthcare needs. So you have like a P1, P2, P3, and depending on your situation, your healthcare situation, you get into those categories. And so shortly before I become the assistant director of the health center here on our tribe, I was on a deferred list. So it was like a P4, and it was for endometriosis. I sat on that list for 2 years. And by the time they approved me, because it wasn't about getting approved, it was because the situation got so severe and my symptoms were so worse, I finally had that taken care of. And the cost for that amount was 3 to 4 times. I did the math by the time I got as working at the clinic, was 3 to 4 months, 3 to 4 times the amount of what it would have been if they would have just done that in the beginning. So I made it sort of like a personal goal to look at those systems and, to keep an eye on those, make sure that we're maximizing our third party revenue, that we're, people that are insured, that we're applying those insurances and whatnot. But I remember before I worked there, when that finally went through, I felt so sad because I was like, did I just take money away from an elder that needed treatment, or a very sick child that was in a different circumstances? Because it made me realize that we were rationing our healthcare money. And so, I don't think people realize that, yeah, there's a lot of systems and red tape, but we have to have those systems and red tape because we're so underfunded.
Definitely. Go ahead, Rose.
Yeah, I think just to add to this, I don't have a lot of healthcare experience like a lot of my peers here. These are people that have been working in healthcare systems for years, and my experience comes from just a patient standpoint. And I think growing up on a reservation and being in such a rural place as Montana, it's easy to see that rural communities, especially rural Indigenous communities, don't have a lot of access to healthcare just by way of getting there. I mean, people have to drive miles and miles to get access to care. And sometimes, things get canceled, or I think a lot of our issues is just like sustainability within healthcare providers. I think throughout my time in the Indian Health Service system I've had providers just stop working in the clinic, and so I don't have a provider, so I don't have a way to meet my health needs. That's happened with behavioral health. That's happened with just regular clinical providers. I've just had people up and leave, and we don't know why, but that is just like an abrupt end to care that people will need. So I think a lot of it is just having sustainable healthcare providers, and also just how far people have to go to access their own healthcare, and how long it takes to be in that system. I mean, you could wait 4 months to get a dental appointment, just like a dental cleaning. So there's not a lot of preventative care happening. It's more about after the fact. And when you come from a population that has been systemically riddled with chronic health illnesses, there's no way of getting ahead of the game. We're always just behind a little bit. We're lagging. And so seeing as prevention is a really important of why I do healthcare and health and wellness in Indian country, that's a big problem for me.
Definitely. I saw hands up for Nicole and then Bart. So between you two.
I just wanted to add on to what Rose was saying, how people had to travel, which was really unfortunate. But people have to realize too that, especially for our tribe, I think it's pretty standard if you're following the IHS guidelines, is if you move out of your service area, your care becomes a different thing. You have contract care and direct care. And when people leave the reservation to try to, improve their lifestyle, whether it's a career change, whatever, and they haven't obtained that outside insurance, again, their care is looked at differently. They're only able to get those services directly at their IHS facility or their tribal clinic. So they may have to travel very, very far to get that, because they won't be covered outside the tribal clinic itself. So again, it's that struggle of, getting the care you need when you need it.
Definitely. And Bart?
Yeah. Everyone's pointed out some of the weaknesses in the historic evolution of the IHS system. It started with reservation promises through treaties to provide health care. And so it became geocentric right away. The doctor and the nurse or the teacher would visit a reservation and provide health care on an ad hoc basis. Then we had little clinics, and eventually in the 90s, we had hospitals. And sometimes now the tribes actually taking administration of the hospitals or clinics. The problem is it's still, by and large, a geographically based system based on limited service areas. And yet IHS is one of the few, other than the Vets Association, veterinary, the veterans people, that have a nationwide system. And we're not taking advantage of the efficiencies that might happen in that system. To the contrary, you have administrative officials who still just preach about scarcity and allocation and trying to keep people basically on the reservation. There was a hearing recently in Arizona to try to make Arizona a single service area so that you could reach 40 to 50,000 natives who weren't on a reservation in a service area. And the BIA people, all they could say, and IHS people, was, well, geez, we wouldn't be able to have the money to service them. And so the implication is, so we just leave them alone and they don't get health care. I mean, literally, that is the decision. Let's not give them health care because we can't afford it. And yet the system is uneven. There are places I've heard. I just visited Phoenix IHS hospital. It looks like a Soviet building from the 50s. And I've heard people who go to it say it's run like one also. Now, the IHS people try to do the best they can, but they're stuck in this system of limited rules also, that you don't go outside of your swim lanes. Other places have consortiums. They've done better. Ironically, mostly in the Public Law 280 states that have all singular state service areas. I've heard great things about the tribal facilities in Oklahoma where all of the state is one service area. I know for a fact that I don't hear any of these kind of problems, or not many of them, in Alaska, where it's a single service area and you can get service at any place, no question asked. There may be some contract health issues, but mostly they've gotten such large numbers that they don't use contract health anymore. They build their own clinics and they provide the specialized service. So you can see through sort of this 638 experimentation that there are solutions to these scarcity issues, and frankly, breaking the mold on this notion that IHS has to run on the basis of scarcity. You've got good managers with good systems in place that actually make the system work. You get an appointment for a dental appointment in Alaska, but it'll be 30 days or less, and you get the full-fledged services. You might not be able to get all of your services in a village clinic, but there are 8 regional hospitals that are fairly good size. And if you need primary care, you could go to Anchorage that has a very large IHS hospital, probably 3 times larger than the one in Phoenix, run by 52 tribes. So there are solutions to these things, but we have to get ahead of the game, like some people have said, and take advantage of this large system. And that's why I got involved with Indigenous Pact, because its larger vision is to have free access to native healthcare no matter where you are. And the people who started it have experience in high-level healthcare insurance and high-level healthcare providers. Frankly, many of us come from these states where the system is evolving and it's no longer primarily a scarcity issue, but rather a management issue. And I think that lesson can be moved across the country and improve healthcare, even for the smallest locations. And I hope that Indigenous Pact is deeply involved with that goal and that process.
Definitely. Oh, it scares me to, because I have been out to Indian country. I've been blessed, in order to experience that and see what it is like out there. And, there are times where I'm taking 3 or 4 flights just to get to one location, and then you're in a car for like an hour driving. So I'm like, oh my goodness, living this day in and day out for simple things like going to the dentist, going to the doctor, getting a checkup, or going to the grocery store it's awful. It shouldn't be, what it is. So I'm glad you guys exist to try and help close that gap and make healthcare more accessible or to provide solutions. So thank you. All right, so let's go ahead and jump into the next question that I have here. What are some of the success stories you've personally experienced within Indian country through the work of IP?
Well, I'll jump in if I may, and it kind of, I think, builds a little bit off of what Bart was saying. And you know, in my role in VP of policy, and it has a lot to do with sort of trying to support the integration and of, you know, working with this broader health system, working with the state Medicaid agency, you know, trying to understand how to properly interpret, you know, the federal law and translate that to state agents or players who might not have the experience. And there's that constant turnover. And like, so that role of education and helping, say, maybe a state Medicaid agency or a behavioral health agency within that state level understand federal Indian health law and how to work in partnership with a tribal health system or a tribal provider, how to, you know, coordinate these systems of care between the native and non-native health systems. And so for me, I find that a lot of, we've had this in different successes. Say, I would say one that I'm really excited about now is working in, say, Washington State, bringing a mobile opioid treatment program into reality, being the first opioid treatment program in the state to do this. It happens to be owned and run by, you know, Muckleshoot Indian tribe, and just having them as a partner, working to bring cutting edge solutions to the table, working with our state and federal partners, helping them and all of us understand how to work together, how to keep each other accountable. And I'm finding that, you know, Indigenous Pact and a lot of the work that I get to engage in, that sort of that space, that really bringing the right parties to the table, helping educate one another on these shared solutions to meeting the needs of not only Indigenous folks, but also how our tribal partners can bring healthcare solutions to non-natives, especially in our more rural and underserved areas. And so I'll kind of stop there, but we have lots of, I think, little examples on my side on the policy piece of educating and helping to bring certain states and tribes and get everybody to understand how to work these things together, especially with Medicaid managed care expansion, et cetera. But Dawn.
So I'm really excited to be a part of this team, and you know, I feel the same way as the rest of the team about why I came to work with Indigenous Pact. This will be my 40th year of working in Indian country, and I always said that if I at the end of my career, I always wanted to be a part of something that was bigger, and I really feel that that's a part of my life right now, that I've come full circle, and this is the bigger part that I get to be involved in. I have the privilege of going into tribal communities and being that advocate for Indigenous Pact and what we can provide, and that intersection of, you know, working with tribal citizens, working with maybe an economic development part of that tribal nation, and the importance of outreach, education, you know, continuity of care with public health, whether it's health, whether it's food sovereignty. I mean, it all comes together, and how exciting to have, you know, this team experience, subject matter experts that are coming into your community to work with you. So, you know, I just really want to kind of make sure that we put that point across. And I have a personal story of my grandmother. You know, she was a diabetic. She did not live within the CHSDA or PRICTA, you know, to get that care that she needed for her diabetic supplies. And she passed away at the age of 57, you know, and that really, you know, that's been my whole passion of my life, is to make sure that I never see that happen again to another family member. So thank you.
Thank you.
Beautiful. Thank you for sharing. Go ahead, Amy. Yeah.
I wanted to say that the thing about the trauma that we all can connect to, even though we're from different nations, is, you know, it's been like we were all smashed apart into a million different pieces. And that happened to our health, our spirits, our mind. And, you know, as I feel like it's such a success that we're even all together, you know, all these different nations, different people all over the country, working with different tribes that have different cultures, different creation stories, different contemporary issues, historical issues. But the one common thread is that trauma of the, you know, picking up all of those pieces after the genocide. And the truth is that we're not leaving the land to our next generations. Many tribes have no access to their sacred sites. Our physical bodies are going to be, in my belief, the one thing that we will be able to carry on for the survival of all of these different nations. And that we can all connect on that and look into each other's eyes and know that there's like that history that we shared. That history is a great success, because I haven't seen it done before, you know, where people are going in to work with tribes and have that heart, you know. And so to me, that is like, I'm in awe of it. And I'm so grateful for everybody at Indigenous Pact, and that I even get to know some of these brilliant minds, and it's a gift.
Absolutely. Thank you for that. Let's go ahead and move on to the next question we've got here. All right, so as a tribal member, how has the experience of working with Indigenous Pact been for you? And I know some of you have already touched a little bit on this, but I'd love to go into greater detail if possible.
I can start. So, you know, I'm born and raised here, been on the reservation with my own tribe all this time. So and then I worked for our health clinic here. So I only know what I know for our tribe and our health clinic. So when I came aboard with IP, I realized that there was a lot of differences, but some similarities with the tribes and their needs for healthcare. So the many differences was that I was so unaware of was the different relationships that the tribes had with their state, and their policies are different, and their state plan amendments were different. So what may be suitable, what IP could offer to one tribe may not be as easy it is for another tribe. So it's so important to have people like Ashley to look into those policies and to advocate to those state, you know, people, and work on trying to, you know, work those out so that they can access things better or whatnot. But the similarities was, again, that need for healthcare and to increase the access and funding for that. And what I noticed a lot of times, even for our own tribe, is there is some funding available. There's a lot of grants to apply for, but they don't either have the manpower. There's a lot of red tape. There's a lot of reporting. So sometimes it's almost not worth it to go after. And it's sad because things like what Rose said about prevention is so important, and the prevention money's there that are sitting on the table, but some tribes just don't have the ability to you know, take advantage of those. And so that's why when, you know, I think of IP and I try to get the word out that Indigenous Pact, hey, we're here to help so much with the tribes that are struggling, that we have people like Ashley that can go out and get and understand the state plan amendments, or people like Dawn can go out and have those relationships between her and tribal leaders. And just know that, I mean, IP is here to maximize third-party revenue for you, to help you understand that, to whether it's technical assistance or keeping up to date with the new policies and procedures or whatnot. So that, when I first heard of IP and all the things they do, it's like just trying to get that word out there. Like, we're all struggling, we all have obstacles, but IP really truly does have the technical you know, and expertise to help provide that. And as you know, I want to say, Amy said about the common thread and common bond between tribes is that, you know, we truly care about our people. We want what's best for our people, you know, and the longevity of our people. So that's why healthcare is so important, that our people remain healthy, remain here, And, you know, being a part of something like IP is truly a personal growth, and very proud to be part of that team.
That's fantastic. Thank you for sharing that. And you know, one thing I can say, you know, at least for the Native Learning Center, this podcast platform, it's been able to spread the word on groups like Indigenous Pact, and I'm so grateful alone for that. So, yeah. Anyone else wanna share their experience?
I can share some information. Just spending a majority of my career in healthcare, being the director of the Treatment and Recovery Center for Menominee here. You know, as being a tribal employee of IP, Indigenous Pact was really, it drew me, the work, you know, the grounded story that Amy and Kurt have. I was drawn in by that, but also the most meaningful thing to me, you know, I always wanted to help my tribe and address some of these challenges that we see. Working in it every day makes you more ambitious and more devoted to finding solutions to help people along the way. And I think what was meaningful to me and what still is that I'm still connected to that work. And, you know, it was difficult to leave working for the tribe, but I think this was an opportunity that I saw bigger growth and the ability to change things on a higher level and still impact my tribe and the people that mean so much to me, and to help other tribes along the way. That's beyond compare. I never thought that I would find meaningful work outside of my own community, because it is important to me. I have, you know, similar personal stories to my peers on how it's impacted my life personally, but also professionally. You see the ins and outs every day of professionals struggling in this type of atmosphere, and to find an avenue to give answers to them, or to help, you know, my peers who I left behind develop and grow their programs into what we need. You can't pass that. I can't pass that. And I'm so thankful that I have the opportunity to work at this level and with this wonderful group of people.
Wonderful. Thank you.
Rose,
Amy, were you
anything?
gonna, yeah, who was anyone gonna say?
Well,
I'm like,
you know,
go ahead.
I know. Go ahead, Rose, please.
Okay. Oh, thanks, Ashley. I think just for me, being kind of a young Indigenous professional, like very new to this healthcare delivery world, I have learned so much from everybody at IP. And I think one of the things that I found just to be the most inspiring is that there's no boundaries or limits to how we can dream up solutions for Indian country. It kind of goes back to what Bart was talking about. In IHS doesn't have to live in scarcity. And I think a lot of the mindset of our team at IP is that we can deliver the best, the top-notch levels of care to our people, to these different clinics, to these different tribes. And we're not limited. We're not limited in the way that we're thinking about delivering this care. Some of the things that I've seen in just our clinic model designing is just like incredible. There's so many different ways that we try to incorporate the family, the individual, the tribal connection in how we're designing rooms or designing mobile clinics. It's incredible to see that we can dream beyond, and I think inspiring other you know, native healthcare delivery frameworks is super important, that we don't have to be limited by what we currently have. We can dream beyond, and that, you know, just ties into our generational thinking about how we can deliver healthcare and health and wellness to the next generations, and that they can dream, you know, beyond what we're just limited to here. So I'm really looking forward to just learning more and more from everybody here, because it's just an incredible workspace and an incredible group of people that have that same mission of just top-notch, next generation, sustainable care for Indian people.
Rose, thank you. couldn't have said it. I mean, that's beautiful, because that's what I would say, just from my own experience, it has been, I'd say, almost personally, perhaps life-saving, because I am such just sort of a rabid advocate, and like so many, we get this fire, you know, and this intensity. It's like you have to direct it in a good way, or it can be self-destructive, and we see that. And so for this personally, I found this to be such a fulfilling, and it continues to be such a fulfilling. It's a life dream. It's like I didn't know what this would look like, but I always had this sense that like there's something, you know, in my future, right? And like it just, silly as it may sound, it's like this is really kind of fit that space. I'm like, you know, not to overstate it, but we have just a really committed, this wonderful group of people that continues to grow. And it's just every day I'm inspired to do more. I think, Darla, you touched on it. And every day I'm inspired to enlist others. I'm constantly trying to recruit everybody I know in the most strangest like connections, because that's my brain. I'm like, hey, you can come work with us. Come work in Indian country. Just come work. There's space for so much, and there's so much innovation. And I like, Rose, the last thing I'll say is you used the word dream and dreaming. And to me, I mean, that is a big part of our spiritual, like this is very much personally a very spiritual endeavor feeling. It's like, I don't have the right words for some of this that I experience. And it's just sort of like continues to unfold. And it's almost like being part of this unfolding dream. And it seems a little silly in some ways. And I don't mean to sound totally Pollyannish or just goofy, but it's just really like, I've never had a job like this. I've never had a job where everybody around you is there to support you. And because this is part of such a bigger mission, and everyone so it's a very unique experience. He's like, how has the experience been? It's unique in the sense that I've never been around such a group of like-minded and spirited people. So it's wonderful, and I'm very blessed.
Yeah,
No, I just
go
wanna-
ahead.
He said
Yeah,
he was
go ahead.
being silly, and I just want to add on to that. Like, we really truly do. We geek right out when we think of these new things. We're in the process of kind of coming up with this new concept for a tribe, and we really truly get excited about that. And Amy's husband, Kurt, I mean, he's always going mind blowing, because he truly gets excited, and he's 100% passionate about what he does every day. And I think that our team is the same way. Like, every day we when we say goodbye and we leave, I have an instant smile on my face, like, good job, team, like, we did good today. And so I think, you know, Ashley's absolutely right. Like, we all have the same passion, and we have the same drive, and to have that excitement to have more people a part of this team. And me and Darla just talked the other day, and I'm like, I have not worked with such a more encouraging and supportive group of people ever. So it truly is amazing.
No, I'm quite familiar with that feeling as well, because I mean, you know, we're not within the healthcare field at Native Learning Center, but we do provide training and technical assistance to Native Americans and those in Indian country. And we try and support those housing authorities that really are behind or struggling. And I geek out when it comes to like strategic planning and OMB, so like funding and all that stuff. And I'm like, let me read it. Let me read the NAHASDA legislation, or, oh, I can find this. So I totally understand what y'all are talking about, because I say it all the time with our compliance director. I'm like, oh my God. And he's always like, you are like exploding with excitement. And I'm like, you have no idea. I totally feel that. But Dawn, you're gonna say something?
Well, I just wanted to make a comment, you know, really, we think it starts with, as Nicole said, our leadership. You know, Kurt Brenkus is just, he's amazing. Look at what he has, you know, put together as a team. He lets us, as Rose said, you know, I get up every day and I get to go to my dream job. I mean, we all get to go to a job every day that we enjoy. We enjoy, you know, our colleagues that we work with. And it's, you know, Mr. Brenkus has a lot to do with that. So we have to thank him for his inspiration, for always challenging us. I love it, you know, because he helps us to think out of the box. And that's how we come up with all of these innovative ways and solutions for the tribes.
Beautiful, thank
Well,
you.
yeah. I love Kurt Brinkus. But I always say this to Kurt, you know, kind of behind the scenes when we're just debriefing and talking about strategy or next steps is, you know, for him, his heart is in it just as much as any other person. He's white, but he held his baby, you know, in that intensive care unit when they said he might not make it today. And, you know, they had us each hold our baby. And he would probably kill me for sharing this story because it's just so intimate. But it's one of those things where he knows just as much as anyone going to a clinic what it feels like to have been slipped to the margins and lose someone to a third world healthcare system within the United States. It's like, we're so fortunate we got to bring our baby home, but infant mortality is the highest in Indian country. And so there's a lot of women, and I think about them all the time. There's a lot of women who didn't bring their baby home. And there's a lot of people who, you know, lost their grandma at 57, or, you know, had a father pass away because he, you know, went to the health clinic complaining of heart palpitations. And they just said, you know, go home and take aspirin, you know, because they're afraid, that scarcity and that fear of losing something that we already have. And so that dream that Rose so magically talked about is like, yeah, you know, I believe that our ancestors would want us to believe that anything is possible and to put our minds and our hearts in the right place and to continue to work, you know, like pray with your feet moving, like do the work that our ancestors, you know, would want for us. And so it really is an honor. Like when I hear all of you guys talking, I'm just like, oh my goodness, I hope I don't sound like a fool compared to how smart you guys are. And I'm just like so grateful that it's a good experience for you and that Kurt is a leader that comes from a good place always, you know? And so that means a lot to me.
I think that says a lot of who Kurt really is. I mean, for a non-Native to truly advocate so hard for Native American healthcare and to improve that system, not just for his own child or children or nephews, for every single Native American out there to build that health equity for Native Americans, says a lot about somebody that is not, you know, Native, that's non-Native and willing to fight and advocate for those, you know, it says a lot about him. It says a lot about Amy marrying such a wonderful man.
Beautiful. Oh, I love this episode. Thank you guys so much. All right, well, we've got one more question that I wanted to pose to all of you. What are some changes that can be made to increase access to healthcare in tribal communities? And anyone, feel free to jump in.
Higher Indigenous Pact.
I love that. That's a good plug right there.
Remove fear. I feel like the fear of losing something that we already have, and if we can be conscious of it as decision makers and have a willingness, you don't even have to change dramatically. It's just a willingness to allow change and be honest with ourselves too about the next 7 generations. You know, that with this data that is provided of how horrible the health conditions are for natives, you know, how on earth could we possibly survive with how sick the earth is too? 7 more generations in any meaningful way that would make sense, you know? And so that's what I think.
I completely agree. And on top of that, I think anyone working to support healthcare in tribal communities, being open and willing to listen and really hear the needs of these communities. These are smart, talented people trying to run these programs and know what the needs are, and just looking for people to listen and adapt these systems to meet the needs. And I think that's what connects, again, Indigenous Pact to the work of supporting growth and movement in this field is the ability to listen and let these leaders lead the needs and ask the tough questions and provide the best support that you can. And that's, you know, I think what our team really tries to do. And I think that's what makes the work successful is we're not going in to dictate what these programs need. There's professionals there that are smart, that know. It's listening to their needs and how can we best support you with our resources. And I think anyone working with tribes needs to challenge themselves to do that.
I wanted to say, I did put a plug in and say hire Indigenous Pact, but, not as just, a profitable standpoint, because we've come into situations where tribes have reached out to us and they don't, funding's a huge issue. So how can they, get the services of another, organization to help them with that? And we are working with them. We are working to find ways that it's not about, us making money. It's not about the cost. We are a business, obviously, and that's, we need to be profitable in some sorts or whatnot. But the true meaning of this organization is to provide that assistance to these tribes. And so we've had to wrap our heads around a particular tribe that we're working with right now on, like, how can we give them what they need and find those resources for them at, a very little to no cost, just sending them in the right direction to make sure that they get what they need. So it's not just about profit here. It's truly about assisting other tribes the best way we can.
Absolutely. Providing the service to help, to ease, any sort of pain or issues that, arise within, the healthcare industry, especially on their end. Beautiful. Thank y'all. Any other remarks or additions that y'all want to make?
Well, I would just like to add that, fully fund Indian Health Services and make it a permanent appropriations, get that out of the control of Congress and the whims and the vicissitudes of the day and wherever they are, and just either commit to fully funding it, number one, or get out of the way. Quit making it so difficult for tribes to take and compact or contract for their own care and services. And I'd say make every state with a tribe in it, every state should be a full PERCTA. Like, okay, if there's not enough money to go around, we can acknowledge that reality, but then let the tribes fill in the gap and make it easy enough to provide care, considering we already know like 70% of the Native folks don't live on a reservation. So, let's just get rid of these artificial barriers and constraints that the feds put on us and just get out of the way and let us do the work in the most respectful way.
Of course. No, but I couldn't agree more. I could not agree more. We work within funding, so I totally understand that, that aspect of it. Anything else, y'all, before we wrap up? No? All right. Does anyone want to do an official plug for Indigenous Pact where they can go to reach y'all and seek whether it is a technical assistance or anything along the lines of the work that y'all do?
Yeah, feel free. We have Dawn.
Yes, please visit us at www.indigenouspact.com, and you'll see representatives who are there to assist you, subject matter experts, and we guarantee that we will return a call or any touch within 24 hours. So please visit our webpage.
And check out our Facebook page.
Check out our Facebook page and our LinkedIn account.
Beautiful. Thank you all so much. I love this episode. We touched on a lot of really important things happening in Indian country, and I feel like we're slowly but surely getting the word out there and figuring out ways to improve our situations. So thank you, thank you, thank you. All right, well, that brings us to the end of today's episode. So again, thank you, our special guests, and thank you, our listeners. We hope you enjoyed today's episode. As always, thanks for listening to the Hobo Thinga podcast. And if you enjoyed our show, please rate and review us on Apple Podcasts, Spotify, Google, and Simplecast. So also visit our website, www.nativelearningcenter.com, to find information on upcoming webinars and virtual trainings. And be sure to come back for more content. Until next time, see you later. Bye.